Welcome to Washington Policy on the Go, Washington Policy Center podcast of news, interviews, and policy analysis.
Welcome to Washington Policy on the Go, the official podcast of Washington Policy Center. My name is David Boze, the Communications Director of Washington Policy Center. And joining me today is Todd Myers, our Center for the Environment Director and author of EcoFads, as well as an upcoming book, which we'll be excited about and tell you about in another future podcast. Todd, you wrote a lot about the COVID-19 risk assessment dashboard dials that the governor had. You had national media attention on that. You had a Wall Street Journal op-ed. And ultimately, the governor, after about a month, got rid of those dashboard dials, picked up some new ones. And you said that the newer metrics were better, but according to your latest blog, we're still in a position of data ignorance when it comes to the metrics that we've set out for ourselves in Washington State when it comes to responding to COVID-19. Explain.
So the previous dials were really more about image than substance, trying to show that he was doing something, because as we showed, what was happening is that even as testing was actually getting worse, the testing dial was showing that they were making improvements. So after we pointed this out for a while, they abandoned that. They've got this new one, as you've mentioned. The problem is that some key elements of that dashboard don't have any data at all. So the concern right now, and the reason the governor is talking about, closing things down again, which I think would be very difficult, is because you're seeing the number of cases increase. We're seeing the number of cases increase, but the number of hospitalizations is also increasing, but not nearly as fast. But what we really care about are populations at higher risk, people in retirement communities, people who work in enclosed spaces. That was what caused the situation in Yakima, where you had an outbreak, was because a couple of people were contagious, worked in a processing plant, and then spread it to everyone else. So these are the folks we really care about, making sure don't get the illness, because it gives a justification for the governor and the government to lock things down again, as they did in Yakima. And yet, if you go to the governor's own dashboard, they have a tab for, quote, populations at higher risk. And what it still says after nearly 2 months of being up there is coming soon. What that tells you is that A, they don't have the metrics to do it, to measure it. They don't know what metrics they're using. And second, they don't have a plan on how to address this problem. So the fact that we are so far into this, and we know that in order to contain this, we have to specifically focus on populations at higher risk, and we still don't even have a way to measure that, just shows you sort of how poorly this has been managed and why it is we're doing a bad job. And the only thing that the governor can do as a result is shut down everybody, whether they're at high risk or not.
Who's ultimately responsible for this metric?
Well, it's on the governor's page. So it is the governor's office, and he's the one who does the press conferences talking about what they're doing. So he's the one who should try to make changes to this. We did have good success when testing was declining. We pointed out that there's no way to contain the illness without knowing who has it, because then you're getting people who are spreading it. And we had success putting pressure on them, on the governor's office, in increasing testing. So our testing has gone up. The problem now is that we're not getting the results in a timely way, which kind of undermines the point of testing. As long as we're not testing, we're testing, but we don't know the results, and we don't have a strategy to protect those at most risk. Again, the result of this is that the only thing the governor can do is put restrictions on everybody, whether you're at risk or not. It's just a very meat axe approach, when we should be, at this point, almost August, using more of a scalpel.
What kinds of things, if any, did the governor's dashboard, the current dashboard, iteration of the dashboard, did it say it was going to be measuring for populations at higher risk? Or are you saying it was just a general tab basically saying, populations at higher risk, we've got a virtue signaling situation where we're saying we care about these populations, but they haven't really specified what it is that they want to track?
Well, I'll read you what it says and what the intent is. And it says, ability to immediately respond to outbreaks in congregate settings, such as long-term care facilities, behavioral health facilities, agricultural worker housing, homeless shelters, and correctional facilities, and address the needs of other populations at higher risk, including the elderly and medically frail. So if you're going to put together a list of people that we need to prevent outbreaks, that's not a bad list, right? I mean, the elderly, right, medically frail, people in long-term care facilities, things like that. So the theory is sound, but there's nothing beyond that theory. And what that shows is that we're really not doing what we need to do. We're still at risk at having outbreaks, and there's no evidence that we can quickly respond to outbreaks. And it really doesn't matter whether you think COVID is extremely serious or you think it's overblown, right? I mean, I know that there's people who debate that. I'm not a doctor, so I'm not going to debate that. My interest is in making sure that the way that the government reacts to COVID is as targeted and effective as possible. And without this data, it is impossible to be targeted. And what we're seeing with the number of cases go up, it makes it very hard to be effective. So where we are right now with the fact that we can't, deal with these populations at higher risk, and that we're not getting testing results fast enough because of a shortage of materials. Again, we're doing a broad sweeping meat axe approach where we harm the economy, where we harm people's lives, and we're having really serious impacts. And unfortunately, we're not making progress toward where we can reduce those impacts while still being diligent.
Why, if why are we still having a problem gaining the raw materials that we need for responses to COVID at this point? Is that a federal issue or is that a state problem?
Well, and this is a frustration, which is that every time these questions are asked, the answer is it's Donald Trump's fault. And what ends up happening is that this simply becomes an opportunity to blame somebody else rather than solve the problem. And I think we're seeing the results of that. What the Department of Health says is that nationally there isn't enough equipment, lab equipment, to do the testing. This is ironic or strange or doesn't make any sense to me because one of the data points that the earlier sort of discredited dashboard had was lab capacity. So they had a number. They said that labs in Washington state could process 22,233 tests a day. That was the capacity that they reported. We have not, I think the highest we've ever gotten, I haven't looked at it in a couple of days, is 16,000 tests in a day. That was the highest we've ever gotten. So we should have plenty of capacity based on their own numbers. And yet, what they now say is, no, we don't have enough equipment anymore, or we don't have enough swabs and other things like that to do the processing of the tests. So it is very unclear to me where the shortages are. I asked the Department of Health what the problem was. They just said, we don't have the equipment, but hopefully we'll have it soon. But like I said, that answer contradicts their earlier data where they said they had plenty of capacity.
Has there been any pushback from the state toward your work, Todd? And, you're asking some pretty basic questions, I think. Is there an example where the media is, taking a look at your work and saying, yeah, this is a valid question, I'm going to ask it too?
Yeah, so I think, one of the reasons, like I said, that we have dramatically increased testing was because the media started consistently asking why testing was declining in Washington state. And that they, again, at that point, they also blamed the federal government for the problem. But as I pointed out, Oregon and California were constantly increasing their testing. Only Washington, maybe in the country, many states were increasing their testing at the time ours was decreasing. So that question was, we got support from the media, and that changed, and that's a good thing. The fact that the dials were sort of incoherent also was raised. Those are gone. That's a good thing. Now I have pointed out this issue that we still don't have a strategy or metric for populations at higher risk. And I may be sort of repeating myself here, but I want to emphasize populations at higher risk. I mean, that should be like the first thing we figure out how to address. And yet it's the last thing that we are focusing on in terms of our strategy, or at least on the dashboard. So we have had reporters now start to ask about this, and on the webpage it says coming soon, and their answer was, yes, we will have that soon. They did not give a timeline. So it just, even if they get it up in the next few days and they have a coherent strategy, that's great. I just don't know why they haven't had that coherent strategy up to this point.
It is bizarre. I mean, I'm somewhat encouraged that people are following your work and starting to ask about it. But, at a certain stage, with Jason Mercier pointing out the law says, we should have called a special session by now, because we know that, we've got a major shortfall coming up, and that's being ignored. In this case, we've got the vulnerable populations, which virtually everyone's been talking about now for months, it's the great tragedy of New York, is the mishandling of those populations, which increased the death toll dramatically. And here we are, months into this, and we're still kind of floundering around, wondering what we should be measuring, what our plan is if there's an outbreak in one of those facilities. And we could easily end up like New York, failing that population, failing grandparents and the elderly and the infirm, because we're not on the ball. I mean, how do you, it just comes down to one of those things where you're asking people, I'm sure, are asking, how do you get accountability when something like this seems so obvious? And right now there seems to be a magic wand, which is you point to the federal government and say it's their problem, but as you and I have talked about in the past, there's a direct state role here, and it's not being done.
Yeah, and I think that there's two parts. There's the part that you raised, which is that you're putting people's lives at risk. Like, that's what we saw in New York. That's why the numbers skyrocketed there, is because they had a strategy that put large numbers of people who were medically fragile at risk. So that's one problem with not having a strategy. But the second problem is impacting people who don't have COVID or are very unlikely to get COVID, because what lack of information does is it means you have to treat everybody equally because you're ignorant. And so as a result of that data ignorance, you're closing restaurants, you're closing businesses. We just saw the economic numbers come out today, and they are crushing. I mean, absolutely incredible. It's the worst drop in GDP in the history since we've been recording GDP. So that's the cost of ignorance. So not only are you putting medically fragile people at risk, you're putting people who are probably not at risk at all in danger of economic problems, and not to mention just sort of taking away their personal freedom. So that's the cost. It costs everybody.
Todd, any final thoughts on the governor on this subject? And I did one quick follow up. I did want to know from you, when can we expect that book? We've been hearing about it for some time. I know you've got your follow up to EcoFeds coming up. Just a ballpark ETA. When do you expect that book to be out?
Yeah, I hope it will come out next year. You can see I've written about these ideas, and the idea behind the book is that if you really care about the environment, then then outsourcing your concern to politicians and hoping that they'll do the right thing, as we have seen, is foolish. They often don't do the right thing. They often focus on things that are, as I've said, as I wrote about in EcoFads, things that are politically popular, not the things that are effective. But the good thing is that people now have more personal tools than ever before to help the environment. And that isn't just about helping the environment, although people want to do that. It's also about, saving electricity, reducing the amount of gas you use. For farmers, reducing the amount of water and fertilizer they use so that they save money in addition to using fewer resources. And by putting the power in the hands of individuals, you align the incentives of economics and the environment in the way that politicians just can't do. The beauty is that 50 years ago when the EPA was created, we couldn't do that. We sort of had to rely on government to deal with the air quality and water quality problems we had. Now the problems are different and the technology is different, and we have this opportunity like never before. And that's what my book is about all of those opportunities, so that conservatives who, when they're polled, show that they actually do more in their daily lives to help the environment than people on the left. Now I want to take those folks who do that already and give them even more tools so that they can be better stewards and be rewarded for it financially. That's, I think, a really exciting opportunity that people don't realize we now have.
Todd, as always, I find your work fascinating and insightful. I really appreciate you making the time. This is Washington Policy on the Go with Todd Myers. David Boze here as your communications director. Stay tuned next week for our next episode. And be sure to let friends know if you enjoyed this podcast so they can sign up and subscribe as well. Again, Todd, thank you so much. Looking forward to that book coming out next year. We've got Dr. Stark's book coming out soon. We'll do a podcast with him, with Dr. Stark, about his new book, which is coming out this month. And we have some major news about our annual dinner event coming up next week as well. This is David Boze, Communications Director for Washington Policy Center on the Go, our official podcast. Thanks so much for listening.
Thanks for listening to Washington Policy on the Go. If you liked it, tell a friend and share this episode on your social media. Send any questions or comments to us at washingtonpolicy@washingtonpolicy.org.